Colorado is not on lockdown, at least not at this point. Governor Jared Polis announced new steps in a planned economic recovery today. He talked about the surge of patients at hospitals, but there was no stay-at-home order to the state. By Monday, millions of Americans in 4 different states will be under stay-at-home orders. Tonight, our Ryan Harrer looks at whether Colorado could be next.
Ghost town. That's the reality, even in America's biggest cities right now. Times Square, no longer bustling. Los Angeles highways without gridlock. California's governor was the first to issue a stay-at-home order.
We are confident that the people of the state of California will abide by it.
Then New York Governor Andrew Cuomo in the most New York way possible.
This is not life as usual. And accept it and realize it and deal with it.
And this afternoon, Illinois and Connecticut did the same.
To avoid the loss of potentially tens of thousands of lives, we must enact an immediate stay-at-home order.
That's roughly 75 million people being told not to venture outside unless they have to. All of this to hopefully prevent further spread of the virus.
We are in real time looking at all of the different actions that different countries and states have taken.
Governor Jared Polis wouldn't say Friday if Coloradans would be under a similar order. But since he's looking at other states, so will we.
Are we reducing density? Yes. Do we want people to stay home? Yes. Are we going to do quarantine? Are people imprisoned in their homes? No.
This is not a full lockdown scenario. All 4 states with the order are allowing for essential workers to still show up. Essential businesses can keep operating too, like pharmacies, grocery stores, and restaurants offering takeout. And yes, Colorado, people are allowed to exercise outside, though keeping distance from others is being stressed. It's something governments across the country are pondering, weighing the threat of further crippling businesses as a worsening pandemic approaches. In Denver, Ryan Harrer, 9 News.
As you heard Ryan suggest there, where the states really differ is when it comes to enforcement. California says that it could hand out misdemeanor penalties for people who don't follow the directions, whereas New York says that it's going to fine businesses that refuse to close. In Illinois, governor said that he's just hoping everybody will work together, didn't specify any penalties, and Connecticut did not get into that as well. There are 39 Coloradans back home tonight after their cruise ship was held off the coast of California. Several staff members on the Grand Princess cruise tested positive earlier this month. Ship docked March 9th and everyone on board was quarantined. So they now have to self-quarantine at home since it hasn't been the full 2 weeks since the ship docked. The health department says that none of the Coloradans are showing symptoms. Colorado's up to 363 cases of COVID-19. And we have recorded 4 deaths so far. Safeway has a plan to protect some of its workers by installing plexiglass right there in the checkout lanes between the clerk and the folks who are in the store. Albertsons, which owns Safeway, says it'll install plexiglass at its checkout lanes in 2,200 stores. Work in some of those stores should be finished in the next couple of days. Safeway is taking a number of other precautions as well, temporarily closing soup bars, wing bars, salad bars, and they also said that they will deep clean their stores at the end of each day. We have heard from a lot of you frustrated about the length of time that it is taking for your coronavirus test results to come back, and today we were finally able to learn about the extent of the backlog in our state. The state lab is behind by 2,600 tests right now. Between that lab and a private outfit, the state can go through about 600 tests a day. There are so many tests coming in and so few results coming out. That is why it's taking days for many of you to learn the results of your test. Denver Health has come up with its own solution to the issue. It's now doing tests in-house. Now, this is not for the public. This is just for people who are hospitalized there and for healthcare workers. Those test results come back in less than a day.
When we can't get quick test results back, we have to treat everyone while we're waiting for their test result as a positive patient. So we're going through masks and gowns and all of the equipment that goes with an isolation patient.
Denver Health can do upwards of 200 tests a day. They are not at capacity because there is also an issue of shortages in testing materials. COVID-19 pandemic has stressed healthcare providers to the point that they're doing things that would have been unthinkable just a short time ago. Medical masks are generally disposed of regularly throughout the day. They're rotated. 9 Wants to Know's Kevin Vaughn found out that doctors and nurses are being told to keep using the same mask for an entire shift.
The guidelines are simple. Fit mask snug to face. Then, discard in a waste container. But with the COVID-19 pandemic, those rules are now out the window at Colorado hospitals.
We had an opportunity earlier this week to pick the brains of some of the folks on the coasts who are about 10 to 14 days ahead of us.
And the advice Julie Lonborg of the Colorado Hospital Association heard?
Preserve now every piece of personal protective equipment that you can.
Personal protective equipment, or PPE, gloves, gowns, goggles, and masks.
We put that out to all of our hospitals and suggested that everyone preserve. We may have some in our supply chest now. We know that if this continues, we won't.
That led to directives like this one obtained by 9 Wants to Know. 1 mask per employee per shift.
So when faced with the decision of not having any personal protective equipment or reusing it, the better of the two evils is certainly to reuse the equipment.
Better, but not ideal in the eyes of 9 News medical expert Dr. Pyle Coley.
Not having any personal protective equipment or having homemade personal protective equipment is essentially a setup for failure, whereas the risk with reusing equipment is certainly there both to yourself and to your patients, but it's a lot smaller than not having that equipment at all.
I don't think that we believe that it makes them more vulnerable now. I think what we believe is it's going to keep them from being vulnerable on the back end when there's no more PPE.
And no one seems to be able to answer if or when there will be enough equipment to meet the coming demand. Kevin Vaughn, 9 News.
State legislators, businesses, and Broncos are teaming up to get gear for hospital workers. On Sunday, they're going to host a supply drive outside Mile High, looking to gather for personal protective equipment that's out in the community. You can drop off supplies from noon to 4. They're asking for unopened bottles of hand sanitizer, bleach bottles, bleach wipes, gloves, also any unused goggles, face shields, masks, gowns, or respirator masks. Unemployment claims in Colorado are likely to reach 25,000. It's a 630% increase from last week. It is a shocking number that the Trump administration is trying to keep quiet. We don't know if we're going to be getting numbers next week for comparison. The U.S. Department of Labor is telling states to stop sharing them as they have been. A letter from the department tells states to use generalities like high increase rather than an actual number. The feds say that the states now can only release unemployment numbers after the federal government does, just once a week. Governor Polis has ordered the state to expedite unemployment claims and has created an emergency economic council. They'll be working on short and long-term steps to help Colorado's economy. Former Denver Mayor Federico Peña will lead that task force. He has most recently been an investment banker.
If you have questions about COVID-19, we have an updated frequently asked questions story on the 9 News app. It includes answers to a lot of the questions you probably have about the virus, how you can keep yourself healthy, and what you should do if you think you are sick. Keep in mind you can also text coronavirus, that's all one word, to 303-871-1491. We'll reply with links to several of our stories.